What if every single night while you sleep, your lungs are silently being damaged? Not from disease, not from smoking, but from something happening inside your own throat that you are completely unaware of. Millions of Americans over 50 stop breathing dozens, sometimes hundreds, of times every single night. Each time it happens, their blood oxygen drops, their lungs struggle, their heart races, and they wake up in the morning with no memory of any of it. Today we are breaking down exactly what happens to your lungs when you stop breathing at night, and the 10 warning signs that tell you this is already happening to you right now. Stay until sign number 7, because that one connects to something most seniors would never expect. Quick note before we begin: this video is for educational purposes only. Always consult your licensed physician before making any health decisions. If you are experiencing severe breathing difficulty right now, call 911 immediately. Here is what actually happens during a sleep apnea episode. As you drift into deep sleep, the muscles in your throat relax. In some people, especially seniors over 50, these muscles relax too much. The soft tissue collapses inward and completely blocks the airway. Breathing stops completely, sometimes for 10 seconds, sometimes for 30, sometimes longer. In those seconds of silence, your body goes into silent crisis. Oxygen in your bloodstream begins to drop rapidly. Your brain detects the danger and sends an emergency signal. Your heart rate spikes. Your lungs contract trying to force air through a blocked passage. This cycle repeats over and over, sometimes 30, 40, even 60 times per hour, all while you sleep, all without you knowing. The result? You wake up feeling like you never slept at all. Exhausted, foggy, heavy, even after 8 full hours in bed. Most seniors blame this on aging, but this is not aging. This is your lungs and brain being systematically deprived of oxygen every single night. And the people closest to you, your spouse, your partner, they hear it happening. The snoring that suddenly stops, the silence, then the gasp, night after night. But nobody connects it to what is happening inside your lungs. Now here is the sign that surprises almost every senior who hears it. And once you understand this connection, you will never dismiss these symptoms again. Untreated sleep apnea does not just make you tired. Over months and years, it causes permanent damage to your lungs, your heart, your brain and your kidneys simultaneously. The NIH has directly linked untreated sleep apnea to a 300% increased risk of heart failure in adults over 60. The CDC identifies it as a major contributor to high blood pressure, stroke, and accelerated lung disease in seniors. This is not a minor sleep problem. This is a full-body emergency happening in slow motion every night. What most people never realize is that the lung damage from sleep apnea compounds over time. Every night of low oxygen accelerates the breakdown of delicate lung tissue. Seniors who go years without diagnosis and treatment often develop permanent reduced lung capacity, even if they have never smoked a single cigarette in their life. The good news is that sleep apnea is one of the most treatable conditions in all of medicine. Seniors who begin CPAP therapy, a simple breathing support device worn during sleep, report dramatic improvements in energy, lung function, memory, and heart health within just 2 weeks of consistent use. The difference between treated and untreated sleep apnea is the difference between lungs that recover and lungs that continue to deteriorate silently every single night. One decision, one conversation with your doctor. That is all it takes to change the direction completely. If you recognized any warning signs in this video, the most important thing you can do right now is talk to your doctor this week and ask specifically for a sleep study. Tell them you suspect you may have sleep apnea. A sleep study is painless, done either in a clinic or with a small device worn at home overnight. The home sleep test is remarkably simple. A small sensor worn on your finger and wrist measures your oxygen levels and breathing patterns while you sleep in your own bed. Your doctor reviews the results, and within days, you know exactly what is happening to your body every night. Here is your 4-step action plan. 1. Tell your doctor you suspect sleep apnea this week. 2. Ask for a home sleep study or polysomnography test. 3. Try sleeping on your side instead of your back. This alone can reduce apnea episodes by up to 50%. 4. If diagnosed, commit to CPAP therapy for at least 2 full weeks before judging whether it works. Seniors who treat their sleep apnea consistently describe the experience as life-changing. Energy returns. Thinking clears. breathing becomes easy again. The lungs that were quietly being damaged every night begin to recover. Your body has an extraordinary ability to heal, but only when you give it the oxygen it needs. Your lungs were designed to work all night while you sleep, quietly, efficiently, and without interruption. When sleep apnea steals that process, everything suffers. But when you catch it and treat it, everything changes. Breathe easy. Live strong. If this opened your eyes, please share this video with your spouse or a family member right now. They may be watching you stop breathing every night without knowing what they are seeing. And subscribe for a new video every week, because your health after 50 deserves real answers.